Hello, good morning students. So today's class is on skeletal system. Skeletal system is generally about the bones which give structures and support to the body. So we will be continuing with this lecture today. So this slide is about the introduction of skeletal system. So bone tissue make up about 18% of the total human body weight. The skeletal system supports and protect the body while giving it shape and form. Next is the osteology. So here you can see suffix and prefix. So suffix is og. Og means study, whereas osteo word is for bone. So we can say study of bone is known as osteology. So it is the branch of science that deals with the study of a skeletal system, their structure and function. So skeletal system is made up of, or we can say it is composed of bones, cartilage, joints and ligaments. So here you will learn function of a skeletal system. First one is support. So it's working as a supportive structure because this is hard, and that's why it can provide support to soft tissues and organs. Second is protection. So protection surrounds organs such as the brain and spinal cord. So as you will see that brain, okay, so it is present inside the skull bone, okay, and same for the spinal cord also. So that is placed inside that vertebral column. Next is the movement. So it allows attachment of the muscle, particular muscles. So bones are used as the levers. It means they are providing fully support for the movement of the muscle. And fourth one is storage. So minerals and lipids are stored within the bone material. Fourth one, this fifth one is blood cell formation. So the bone marrow is responsible for cell production. Next is division of skeletal system. So human system has been divided into two parts as per its anatomical location of the bone. So axial skeleton and appendicular skeleton. So bone of the skeleton are grouped into two principal divisions. So this you can say is principal division also. First one is axial skeleton. In axial skeletal there is a presence you can see of skeleton bones, auditory ossicles, hyoid bone, ribs, sternum, breastbone and bones of the vertebral column. So in generally if you want it to learn in easy way, you can see axial skeleton in the sense in a vertical shape. ठीक है, इसको आप ऐसे देख रहे हो, straight format में देख रहे हो. So skull bone will be there, okay, skull will be there, then auditory ossicles means ear bones will be there, then hyoid bone will be there, and in chest bone sternum will be there, and nearby there will be a sternum bones you can see. Second is appendicular skeleton. So appendicular skeleton is for mainly upper and lower limb extremities, and it plus bones forming girdles that connect the limbs to the axial skeleton. So in this slide you can see division of skeletal system. So you can see two different skeleton. This is axial and this is appendicular. So what I have told in last slide that you can imagine axial skeletal as in like it is in standing format now. So vertically you can imagine these bones. So skull, then ear bones, ossicles we can see, then hyoid, okay, after that sternum and ribs both sides. So we can say axial skeletal is made up of 80 bones. In skull, cranium is having 8 bones, then 14 bone is for face, hyoid is single bone, auditory ossicles, then vertebral column 26, and then thorax, sternum plus ribs, these are of 25. So total it will be 80. Next is division of appendicular skeleton. Appendicular skeleton you can see shoulder girdles, pectoral girdles जिसको बोलते हैं, और shoulder bone you can see. So this will be covering two bones, clavicle and scapula. So you just focus on this bluish part. Here you can see axial skeletal. It is this color is representing the axial skeletal, and here it is representing the appendicular skeletal. You can see extremities. Okay, so first one is pectoral girdles. In pectoral girdles there is clavicle, two clavicular bone and two scapula. Then you come to the upper limbs. In upper limbs there are two humerus, two ulna, two radius, 16 carpal bone, because each one is having 8. So we will be learning all together both sides. So 16 carpal bone and 10 metacarpal bone, so 5 for each. Then 28 phalanges. Next come to the pelvic girdle. Pelvic girdle, so hip, pelvic or coxal bone, this is of 2. So each side you can see one side ischium bone and one side. Okay, so this will be 2, which is in pair. So two hip bone will be there, two femur will be there. You can see one, two femur will be there, two patella will be there, two fibula will be there, two tibula will be there, and then tarsals will be 7 each side. So it will be 14. Then metatarsals 5 each side. It will be 10, and phalanges 14 each side. So it will be 28. So total count of the appendicular skeletal bones are 126. So in this slide you can see classification of bone based on their shape. So bone can be classified as per their shape. It may be long, it may be short, it may be flat, it may be irregular, and it may be sesamoid. So here you can see long bone. So humerus and femur, tibula, fibula, these all are your long bones. Here you can see a flat bone. Okay, so flat bone is what? Like your sternum. This is the sternum which is connecting with your ribs, middle portion of your chest. This bone is known as sternum. So you can see it is a flat bone. It is a flat in shape. Next come down to the irregular bone. So you can see vertebra. Vertebra is irregular type of bone. Here you can see sesamoid bone. So this patella bone, this is now sesamoid bone, and here if you will come at the right of your hand, you will see the wrist bone. So that is known as your carpal. Okay, so that is also known as trapezoid. So only one type, not all carpal bones. So only one type of wrist bone, that is a trapezoid. It is a short bone. So in this slide, you can see classification of bone based on their shape. So first one is long bone. So long bones, we can say that kind of bone which are having greater length as compared to their width, and it will be having slightly curved in between for providing them strength so that they can bear weight easily. And the example of long bones are femur, tibia, fibula, humerus, ulnar radius, and phalanges bone. Next is short bones. So short bones are cube shaped and are nearly equal in length and width. Example, carpal and tarsal bone. Third one is flat bones. So thin and composed of two nearly parallel plates of compact bone tissue enclosing a layer of spongy bone tissue. These all are flat bone. Example, cranial, sternum, ribs, and scapula. Fourth is irregular bones. So complex shapes and cannot be grouped into any of previous categories. For example, vertebra, hip bones, some facial bones, and calcaneus. Last one is sesamoid bone. It protects tendons from excessive wear and tear. Example, patella, foot, and hand. So here we will learning skeletal system. So skeletal system is consist of skull, vertebral column, like spinal column, thoracic cage, and sternum. Okay, so in this slide you can see skull. This is a diagram of your skull which is having many bones. So in the front you can see this color is for frontal bone, and if you will come down you can see different like at the side of this frontal bone, this is parietal bone. If you will come down you can see sphenoid bone, then this is orbital, this and this side you will come, this is ethmoid bone. Then just down to the this ethmoid bone you can see lacrimal bone. Then zygomaxillofacial bone is here. Here is zygomatic bone, which is your cheekbone. And if you will see the nasal bone, so this is inferior nasal conchlea, and just come to this side, this is maxilla. This is maxilla, and this is the bone which is known as vomer. Okay, so if you will come, if you will see this cavity, nasal cavity, this is a vomer, and if you will come down, this is known as mental foramen. So in last class, as we have learned that skull, in which there was division of cranial bone like cranium and facial bone. So first one is the cranium. So what are the bones which are covering under the cranium? So it is formed by flat and irregular bones that provides a bony protection to the brain. First one is frontal bone. So it forms the forehead. It forms part of your eye sockets. The coronal suture joins the frontal and parietal bones. So suture is that something which is joining two bones in between. So coronal suture is joining part of frontal and parietal bones. Second is two parietal bones. So if we are learning our cranium now, so it is made of one frontal bone, two parietal bones. Next, parietal bone. So it forms the side and roof of the cranial cavity. It articulates with each other at sagittal suture. It joins the frontal bone with coronal suture and occipital bone with lambdoid suture and the temporal bones at squamous suture. Next is two temporal bones. So these bones lie one on each side of the head and form immovable joints with parietal, occipital, sphenoid and zygomatic bone. The temporal bone articulates with the mandible at the temporomandibular joint. So in axial skeleton, you can see next bone is one occipital bone which is present at the back of your head and most of the base of your skull. It has immovable joints with the parietal, temporal and sphenoid bone. Next is sphenoid bone. So sphenoid bone, this is one sphenoid bone. So it occupies the middle portion of base of skull and it articulates with the occipital, temporal, parietal and frontal bone. Next is one ethmoid bone. So it occupies the anterior part of base of the skull and helps to form the orbital cavity and nasal speculum. It is very delayed bone, bone containing many air sinuses. Okay, and these sinuses are opening into the nasal cavity. So in this slide you can see the axial skeleton in which there is a uh, your facial bone and skull. So we can say skull bone is there and it is representing various bones of cranium and skull with the suture. So this is your frontal bone. Next it is parietal bone and this is your external occipital bone and this is, you can see, this is mastoid bone. And if you will come to the face side, you can see this is sphenoid bone, then this is lacrimal bone, ethmoid bone, then this is nasal bone, and here you can see this is articular tuberculi which is joining your this temporal bone and this temporal process. So this is articular fasciculi and this bone is mandible. So this class was based on your structure skeleton, in which we have learned axial and appendicular structure part, and we have focuses mainly on your cranium and facial bones. In next lecture we will be continuing with the remaining bone. For the content you can follow this mentioned link. Okay, thank you all for listening. Hope this class will be useful for you and you will be clear with the content.